everybody? How you doing today?
Hey.
So we have, this is going to be the second iteration in our series of videos talking about instant gratification and exploring reasonable timelines for kind of injury or wound repair and how physical therapy kind of comes into play with that. So Shannon's going to kind of take the lead on this one and kind of talk about timelines on what should be reasonable for people to expect them to get better.
Okay. So first of all, it's a very broad topic, right?
Yeah.
So one injury is certainly not the same as the other, right? In the general overall picture, we have to consider like the physiology of tissue healing, right? And there's a lot of things that affect that, but even under optimal circumstances, you know, tissue healing is a good 6 weeks, right? If you've ever broken a bone, severely sprained your ankle, anything like that, they almost always immobilize you for 6 weeks, right? 6 to 8 weeks, and that's about how long the process of tissue healing takes, right? Give or take, you know, depending on your general health and the severity of the injury, how many tissues are involved, and there's things we can do to optimize that, but there's just some things we can't make happen faster, right? I mean, even professional athletes, they have to be immobilized for that certain period of time to allow healing, right? The process of moving forward following immobilization, of course, is, again, dependent on, a lot of times we'll have protocols for certain types of injuries, depends on how long it takes to restore strength, tissue mobility and flexibility. And then the later stages of rehab are going to involve, you know, resilience in the tissues, right? Before you go back to full function, so that we don't go back to loading those injured tissues and then start all over again by re-injuring it.
You mentioned the first 6 weeks, I like that. And you do see that often. It'll be a couple weeks, you know, around 2 months-ish. I think some of that has to do with the acute inflammatory mechanisms going on within the first day, 3 days, you know, 2 weeks that occur, and then kind of some remodeling of tissue at that point where collagen is laid down. There's a lot more nuance into that, but I think when Shannon kind of mentioned the rehabilitation aspect and the strengthening, the re-strengthening afterwards,
right?
Whenever you damage any tissues, most of the time, I mean, the great majority of the time, you're never going to get full 100% function back. If you had like a tear or even a sprain, there may be maybe a few percentage points of weakness that your body can heal, but it doesn't heal exactly to that original structure.
And the good news is that all the time we're seeing studies where they're comparing, for instance, a herniated disc in someone's back, right? Very common. You could look at a number of patients that have an MRI with a herniated disc, but zero pain, right? So just because we have a tissue injury too doesn't mean that we're going to be in pain, doesn't mean that we're going to have dysfunction. So sometimes we have to take that information with a grain of salt, because I mean, very often people have damaged tissues, but they get really good at using other tissues too to compensate and restore a normal movement pattern and normal activity. So I think especially as we get a little bit older, right? Like we're probably not going to look at anybody over the age of 40 that has a pristine spine, right? It's probably not going to happen.
All the crazy stuff I used to do, I know, my spine.
So some of those things are just normal degenerative changes, but they really don't affect what we could be doing, right? We can keep our inflammatory levels low with diet and proper hydration and all those things. And Dr. Lytle could speak to that, you know, more specifically about what things help with
detox the body.
inflammation,
right? For sure. That's
castor oil packs to the liver.
There's even mustard packs where you take mustard seed and you can apply that. That's a little bit, you know, that might burn a little bit, but there's specific instances why you'd want to use it. But yeah, you had mentioned 40 years old, and usually when you're dealing with platelet-rich plasma, any sort of injection where you take the blood, you spin it down, and you get the platelets and the plasma out of the blood. Usually people after 40 years old, the adage is that the quality of that PRP is less. So sometimes people will, or physicians or anyone will recommend you add stem cells or you add something to the PRP where you're adding growth factors in because that blood is just not as nutrient dense, or the body just doesn't make as much growth factors as it did before 40. So that 40 is kind of like a rough indicator of how you're going to respond and how you're going to heal.
I'm going now, thanks.
Yeah.
You know, and I guess I should say too, I feel like when I initially talked about that first 6 weeks, I really mentioned immobilization a lot, which is true in some cases, but the idea of mobility overall to prevent stiffness is still really, really important. So it's very injury specific, right? If something needs to be immobile to heal versus restoring mobility.
So if you have like a shoulder and your shoulder's painful and you didn't tear anything or tear a rotator cuff, so you're saying, so I always thought, this is always been my thought was, move through it,
right?
But just don't be stupid about it. You know, don't try and lift super heavy or just gonna get the blood flowing through there and keep it moving.
Right. So so I think it depends on if we need to allow something to lay down a scar, right? By limiting the mobility for a period of time. Say if you tore your rotator cuff, something like that. We certainly don't want the shoulder to stiffen up, right? So we're by doing some kind of passive or assisted motion and maintaining mobility in there with a soft tissue injury like that would still be good.
Yeah, no head over.
Now if you went
and
fractured your elbow or your shoulder or something like that, then it may be more indicated to have immobilization to allow healing. But even then, sometimes they'll have you start doing mobility early on to prevent it from getting too stiff while just protecting. A lot of those things are very early mobility.
I think there is definitely more of a push for mobility early to give the tendons and ligaments more elasticity. You get a little bit of fibrous tissue and scar tissue that will form, but if too much immobilization is there, then you get loss of function. You get
so I guess we should describe it more as like an appropriate amount of protection.
And is that dependent on severity as well?
I believe so. Yeah, I mean, I think it depends on which tissues are involved, right? You know, if you have a bony fracture, you know, we have to immobilize that for a sufficient amount of time to allow that to heal. But a lot of times with the soft tissue injuries, we might protect a certain portion of, say, your ankle, right? So we might avoid a certain direction of movement, but make sure we're maintaining the other directions, right? To specify which tissues need to be more protected than the others.
If you like our video, that's the end of it there.
Like and subscribe.
Subscribe.
Or we'll hurt you.
Or we'll hurt you. Or offer you a tablespoon of peanut butter. I think either one probably.
Hurt you and they give you a tablespoon.
Yeah. There we go. We'll love you and push you at the same time.